Welcome to week 38. In this video, I'll be talking about your baby's development, signs of labor, things you should be discussing with your doctor or midwife before delivery, and so much more. But first, if you're new here and you're watching in the health and medical zone, that means in good health and spirit. So if you like being healthy and happy, go ahead and click subscribe, because you're in the right place. At 38 weeks, you're halfway through your final month of pregnancy, which means you're only about 2 weeks away from your due date. Now, keep in mind that only about 5% of women actually deliver on their due date. Due dates are really just estimates of when your baby might arrive. It's completely normal for babies to come up to 2 weeks early, and it's also normal for them to come up to 2 weeks late. You do have a little bit of control over when your baby is delivered, though, because you may have the option of induction as early as 39 weeks. Now, is that something you should do? That's entirely up to you, your personal preferences, and your OB's recommendations. Your baby now weighs around 7 pounds, give or take, and measures about 19.5 inches long. By this point, your baby's lanugo, that fine hair that developed early in the second trimester to help keep them warm, has mostly fallen off. However, your baby may still have some on their shoulders, back, arms, or even their cheeks. Don't be alarmed. This is completely normal and will usually fall out within the first few months. Right now, your baby's eye color is typically dark brown, dark blue, or gray, and you likely won't see their permanent eye color until they're around a year old. All of your baby's organs are fully developed, and even their lungs are ready to take that first breath. That said, every additional week of development helps reduce the chances of complications. As for you, I know you're probably really feeling it right now. You may be achy, exhausted, not sleeping well, dealing with swollen legs, and having cramps, I know. But you are so close. Hang in there. And let me know how you're doing in the comment section below. If you deliver at any point during this time, I would absolutely love to hear how your delivery went and how both mama and baby are doing. Take the opportunity to brag about your beautiful baby. I truly love reading those stories. By now, your body is preparing not only for delivery but also for caring for your baby. Even if you're not planning to breastfeed, your body may already be producing colostrum. Colostrum is the first form of milk your body makes, and it's packed with antibodies. It's higher in protein and lower in sugar and fat than mature breast milk. Your body will continue producing colostrum for a few days after delivery, until your milk comes in. It's also not uncommon to start producing colostrum before your baby is born, so if you notice some nipple discharge, that's most likely just your body getting ready just in case you decide to breastfeed. Now, before your next OB appointment, make sure you write down all of your questions about delivery. Sometimes when we're at our doctor's appointments, sitting in the exam room, we completely forget what we wanted to ask until we get home. Keeping a list helps make sure all of your concerns get addressed. Be sure to ask about situations where you should go to the hospital, questions about getting an epidural if you're planning on having one, whether or not you should be doing perineal massage, and if you're having a C-section, ask about recovery time or anything else you might be worried about. It's always better to ask these questions now rather than when you're already in labor. In previous videos, we've talked about the things you really need to have before your baby comes home from the hospital, things like a car seat, a crib or bassinet, diapers, and wipes. Today, though, let's talk about the things you'll want at home to help you as you recover from delivery. First up, pads. Your body is going to bleed after delivery, even if you have a C-section. You'll still experience bleeding in discharge, called lochia. How long this lasts varies, but it can continue for up to 6 weeks. During this time, it's not recommended to use tampons because lochia can contain bacteria, and you don't want anything blocking that flow. If you delivered vaginally, your vagina also needs a break, so don't mess that up by putting anything up there. And yes, that includes a penis. No vaginal sex until you get the all clear from your OB or midwife, which is usually around 6 weeks. Especially in the beginning, your flow can be pretty heavy, and regular pads may not feel like enough. You want to be prepared so you don't ruin underwear, sheets, or favorite clothes. You have a few options here. One is asking the hospital to send you home with extra mesh underwear if you've delivered before. You know exactly what I'm talking about. They're basically fishnet-style underwear that you put pads into, and they're great because you don't feel bad tossing them when you're done. You can also buy disposable postpartum underwear, which is basically pads and underwear all in one. They're very absorbent and easy to throw away. Another option is period underwear. These absorb blood and urine like a pad, but the underwear itself is washable, so you can reuse them over and over. The nice thing about period underwear is that you can keep using them even after you've recovered for your regular periods. If you're planning on breastfeeding, go ahead and get yourself a nursing bra. You'll also want nursing pads for the first few months because breast milk does leak. Nursing pads help keep that from soaking through your clothes. I also recommend having something on hand to help your nipples. There are creams and special pads you can use, and honestly, the first few weeks of breastfeeding can be painful. Having something to soothe sore nipples can make a big difference. After delivery, your vagina may feel swollen and sore. A few things can help with this, including ice packs. You can make them at home or purchase them, and the hospital will usually provide some as well. They really do help. If you delivered vaginally, I also recommend using a perineal bottle. Urine can burn the very tender vulvar area, especially if you had stitches. You can fill the bottle with warm or cold water, whatever feels better for you, and use it to rinse after using the bathroom. It really helps with comfort during those first days. You may also want to pick up some Epsom salt. An Epsom salt bath is simply a warm bath with Epsom salt mixed in, and sitting in one can really help soothe soreness, swelling, stitches, and overall postpartum recovery. Okay, moving on, remember to keep up with your kick counts, and make sure you're moving a little more slowly these days. Certain twisting or bending movements that were fine earlier in pregnancy can now cause more discomfort than usual, so be careful. If your belly is itchy, use some lotion. Elevate your legs if they're swollen, and check your wedding ring to make sure it isn't getting too tight. Hands can swell quite a bit at this point, and we don't want a tight ring cutting off circulation, so you may want to leave it off until after delivery. Also, be sure your hospital bag is packed and ready to go. In weeks 36 and 37, I talked in more detail about the signs of labor, so if you missed those videos, make sure to check them out after you finish this one. But just to review, the softer signs of labor, meaning you don't need to rush to the hospital, but labor may be approaching, include losing your mucus plug, noticing a bloody show, baby dropping, also called lightning, or having more frequent Braxton Hicks contractions. Just keep an eye on these signs. Now let's talk about the true signs of labor. Early on, you may experience diarrhea, backaches, shivering, or mood swings. All of these can happen as your body moves into true labor. If your water breaks, go to the hospital even if you're not having contractions yet. Water breaking can feel like a big gush of fluid, but it can also be a slow trickle. The tricky part is that urine leakage can feel very similar, especially with the baby pressing on your bladder, which is common when the baby has dropped. If you're certain your water broke, head to the hospital. If you're unsure whether it's your water or urine, call your OB, and they'll guide you on what to do. The only true way to know you're in active labor is through contractions. Real labor contractions are regular and become closer together and more intense over time. They usually last between 60 and 90 seconds and become strong enough that you can't continue what you're doing. You'll need to stop walking, stop talking, and focus on breathing through them. True labor contractions also don't slow down when you lie down to rest. They continue to get stronger and closer together. At your next OB appointment, talk with your doctor about when they want you to go to the hospital. A good rule of thumb is that if you're having regular, painful contractions every 10 minutes or less for over an hour, it may be time to head in. I am so excited for you, and thank you to everyone who has been sharing their experiences with me and with each other. I absolutely love seeing how supportive you are in the comments. Remember, everyone watching this video is right where you are, so they truly understand what you're going through. Feel free to reach out to one another. We have an incredible community of women here. And if you know someone who's pregnant, be sure to share these videos with them. Induction won't be done simply because you're uncomfortable, tired, and ready for the baby to arrive. However, if you want to, you can talk with your OB or midwife about induction at 39 weeks, not before, or you can choose to wait and allow labor to begin naturally. Thank you so much for watching.